coronavirus this Wednesday morning, hallucinations, seizures, even paralysis. These are some of the neurological effects COVID-19 patients have experienced. It's just another mystery surrounding COVID that is really leaving doctors puzzled and realizing there is still much to learn about how this virus impacts people, and significantly differently. To discuss this further, we're joined this morning by Dr. Amy Serin with the Serin Center here in Arizona. So Dr. Serin, thank you so much for joining us this morning. I mean, there are just so many questions surrounding COVID and potentially its lasting impacts on those patients who recover, quote unquote, and return to a normal life, or maybe didn't suffer very severe symptoms. So talk to me about some of the cases where you're seeing something as severe as seizures or psychosis.
Yeah, it's an interesting thing that, we really look at health outcomes when someone has a major illness, and then they get discharged from the hospital, and sometimes we don't follow up. And it's very, very important for us to acknowledge that there can be lingering problems in the brain after discharge, and also pay attention to the people who never make it to the hospital. They may have mild to moderate symptoms of COVID, and then 3 months, and maybe even we're going to find out that 6 months or a year later, they're going to have problems with their jobs or relationships or school because their brain just didn't quite recover. And we are just starting to untangle this mess now of what COVID does to the brain. And I wish we had better news, but it's not looking great.
So is this primarily in connection to inflammation in the brain, or in what way is the virus targeting the brain? I mean, you kind of have a better understanding of why it would be having a potentially lasting impact on the lungs, for example.
Sure. So any virus or major problem can wreak havoc on the brain, even if it doesn't travel into the brain. Now, autopsies have not showed that the virus itself is getting into the brain, but what it does is it can create a very overreactive immune response, and that overreactive immune response can impact the brain. We can get swelling, we can get hemorrhaging and brain bleeds. We can also get blood clots in the body that can either travel up to the brain or be formed in the brain, and these complications are causing major problems for patients with COVID.
I have known a few people who've had COVID, and afterwards they have described like brain fog, say, as people would say, kind of just a forgetfulness or not a lack of sharpness that they would have had prior to, and the emergence of headaches that are comparable to migraines that maybe they didn't suffer from before. So would these effects be short-term or potentially for some permanent?
They may be short-term, they may be permanent. I look at other health outcomes. So we have a lot of patients who have gone through chemotherapy, for example, and chemotherapy actually impacts the brain, or patients who have had mild concussions or other illnesses. And when I look at the trajectory of how they recover, oftentimes if they don't get some kind of intervention, they don't quite go back to themselves even after 1, 2, 3, 5 years. And the thing that most people don't realize is that once you have a problem, this can create other problems. So sleep problems are a big deal, right? And if you have sleep problems as a result of something, that's going to affect your daily functioning moving forward if you don't correct it. So we really want people to be paying attention to their brains post-COVID and know that they're not at a dead end in terms of treatment if maybe one doctor says that they're fine physically and they're discharged, because a lot of doctors are specialists and they don't necessarily have optimum brain functioning on their minds.
So, Dr. Serin, to close, if somebody is experiencing this or seeing some changes, maybe in a relative or close friend, maybe behavior changes or cognitive seeming changes, what type of doctor would you suggest they see? And I imagine it's important to remind people that even though you think about any brain injury or damage to the brain as a terrifying outcome, repair can happen through some of the cognitive resources and tools that are available, right, through almost therapy and exercise.
Absolutely. Our new neuroscience is just amazing. And some of the greatest treatment aren't even really in the mainstream yet, because people really are kind of obsessed with chemicals and consciousness in terms of treatment modalities. But we can do on an outpatient basis in 45 minutes in a clinic, we can do a quantitative electroencephalogram, that's called a QEEG, and look at the brain and how it's functioning in real time. And when we can see that, we can actually use non-invasive non-chemical methods such as neurofeedback, or even some more cutting-edge therapies that go beyond talk therapy, like EMDR therapy. And we really can go back to getting their brain optimized. And the research is clear that even with people without brain damage who have PTSD, let's say, from a medical illness, we can usually treat that in 6 sessions of EMDR therapy. And for some of the milder or moderate cases of brain functioning problems, we can treat that in about 10 to 30 sessions of neurofeedback. So there is a lot of hope, but I think people shouldn't just accept the fact that, okay, I had this disease and now I'm just going to have insomnia for the rest of my life, or I'm going to have brain fog, or I'm going to not do as well at my job. I think that we really want to look at improving those outcomes, and there is hope. And with some of our new treatments, it's not as bleak as it used to be.
Dr. Serin, thank you so much for your insight. Interesting conversation.
Thanks, Olivia.